health bosses have warned that the NHS cannot take any more disruption amid the 4 days of strike action staged by junior doctors.
Services are at tipping point, according to NHS providers, with the cost of covering the industrial action at an estimated £1 billion, as well as leading to thousands more postponed treatments for patients.
But how much support do junior doctors actually have from the public? Our reporter Anna Riley has this report.
It's the 5th time junior doctors have walked out of the wards this year. Their union, the British Medical Association, have refused to accept the government's final offer of a 6% pay rise and instead want a 35% uplift. But doctors on the picket line at Leeds General Infirmary and across England are also fighting for improvements in the NHS.
We're here making a stance because it is imperative that we save our NHS. Each and every one of my colleagues here on the picket lines, as well as at work, have already considered an exit strategy if this dispute is not settled. They're looking at other countries, they're looking at other professions altogether. This is how desperate we are. It is heartbreaking that patients actually end up coming in as an emergency operation when they could have had a safer, better outcome operation on an elective list. And this is the result of the pressures and the massive pay cuts and funding cuts that the government have forced upon the NHS.
Industrial action has led to 835,000 postponed appointments, and this is adding to the hospital backlog that topped 7.6 million for the first time at the end of June. This means nearly 1 in 7 people like Anastasia Tempest are on a hospital waiting list.
I've actually got a serious gastroenterology problem and it affects my nerves. I've been on a waiting list for over 3 years and I'm interested, this is a new thing, I'm interested in going private if the NHS will allow. Yes, I realise that the NHS on one level is successful, but on another level it's cracking.
And here's what people in Yorkshire think to the ongoing junior doctor strike action.
They've been let down by government after so long. They are due that money. They work damn hard and it's not recognised.
I do support them striking, but I don't support the amount of money they're asking for. I think it's ridiculous compared to other pay deals.
It's all about the money, you know, they're more interested about the money than other people's health. And I think that it's wrong.
They're doing a fantastic job and they should be paid triple the amount than what they're getting paid now.
The hospitals are full as it is and, you know, there's no reason for the junior doctors to be on strike.
The industrial action is due to end at 7 a.m. on Tuesday, with the BMA urging the government to get back to the negotiating table or face further strikes. Anna Riley, GB News.
Well, joining us now to tell us more is NHS GP Dr Raj Arora. Good afternoon to you. Thanks for talking to us again. We've heard what people think there, or a few people think. Junior doctor strike ends tomorrow. Has it achieved anything at all, this latest strike?
That's a tough one. I think it has achieved again the awareness, and obviously the junior doctors are out there striking. They're not in the hospitals. They're not giving up. And that's the message that's been given out, which I think is super important, given that, you know, the junior doctors are at breaking point. It was interesting, the response from the public. Obviously, it's quite mixed. And I think you would expect that because, of course, the NHS is already under pressure and, you know, doctors don't want to be striking. And, of course, there's been a big disruption and we know that. But I think also there's been a mixed response. And now, you know, some of the public certainly are supporting junior doctors as well and saying, you know, they ought to be given their uplift or their restoration, as it was, and to be paid what they deserve to be paid in line with, obviously, inflation. But I think it's not clear to the public, really, what junior doctors do. Not everyone's aware of that, how much of the workforce they make up. And I think those kind of things can lead to maybe some public, you know, feeling as though, why are they striking? But really and truly, they are at breaking points. I think it's good that they have gone ahead with the strike, but yeah, whether there's going to be negotiations back at the table, that's another story.
It is interesting looking at where public opinion is on this? Because there is general sympathy in terms of saying that junior doctors should get some sort of pay rise. But then when you drill down into that sympathy and say, should junior doctors get a 35% pay rise, most of the public, focus groups and polls show that people think that is excessive at a time like this. Have the junior doctors to some extent shot themselves in the foot by asking for such a high increase when most of the public thinks that would be excessive at this time?
Yeah, great point. I think, look, it's not, first of all, it's not a pay rise, okay, so it's pay restoration, so that needs to be made really clear that it's actually not an uplift on their pays. To go back to where, from 2008, there's been no restoration in pay, so they're actually on the back foot when it comes to their finances and their salaries. So I understand that from that point of view. Having been a junior doctor myself, is very difficult, so I get that. But I think what you're saying is correct. You know, that it's a difficult time financially for the government, for everything that's happened with COVID, Brexit. So I think there's a whole, there needs to be a discussion whether that negotiation is that they get 35% now, which is probably unlikely, or whether they're going to get, you know, some restoration over a number of years, which might be more feasible, or there might be a discussion about the future and how that works when it comes to money, which might be more acceptable. I don't know, but I think, again, that discussion has to happen. So we need the government to come and sit at the table and talk about that going forward. But yeah, of course, because of where we are in the economy right now, there will be public, who feel that actually junior doctors deserve 35% at this point in time. And that's a question that I think the government need to address and actually come up with a solution. And it's not, and I know the public are saying, it's all about money. It's not just about money. It's about the years of letdown. You know, this is a loaded strike. So it's not just, we're striking for 5 days, here we are. There was a strike a few years back, it ended after a few days, blah, 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 whatever. But I think the question now is, how much longer are you going to push the workforce in the NHS to keep working under strain? Unless you've done those shifts as a junior doctor, in those shoes, you don't really know what they're fighting for. And I've been there, so I know how tough it is.